Right now, somewhere in the world, a woman is about to give birth. She is lying on her back under fluorescent lights with her legs in stirrups. There is a doctor she met 2 hours ago standing between her knees. There is a machine tracking her baby's heartbeat. There is an IV in her arm. There is an operating room down the hall in case someone needs to cut her open to get the baby out. This entire setup, the lights, the monitors, the surgical team on standby, exists because human birth is the most dangerous delivery of any primate on the planet. Now take all of that away. No hospital, no doctor, no anesthesia, no operating room, no sterile instruments. Just you, the ground, and the worst pain your body is capable of producing. For over 300,000 years, every single human being who ever lived entered the world this way. And somehow, enough of them survived for you to exist. Here is something almost nobody knows. When a monkey gives birth, the baby comes out facing toward the mother, head first, face forward. The mother can reach down, grab the infant, pull it toward her body, and clear its airway herself. No help required. The whole process takes minutes. When a human gives birth, the baby rotates. The human birth canal is not a straight tube. It is twisted. The entrance is widest from side to side, but the exit is widest from front to back. So the baby's head has to enter the pelvis sideways, then rotate 90 degrees midway through, and emerge facing away from the mother, toward her spine. Anthropologist Karen Rosenberg and evolutionary biologist Wenda Trevathan published a landmark paper in 2002 that described this as the defining feature of human birth. In their words, the baby is typically born facing away from the mother. This means she cannot see the baby's face. She cannot easily reach down and guide it out. She cannot clear mucus from its nose and mouth. She cannot even safely unwrap the umbilical cord if it is around the baby's neck, because pulling the baby toward her means bending its spine against the direction it is facing. No other primate has this problem. In every other species, the mother can catch her own baby. In humans, she cannot, not because she is weak, because the anatomy makes it physically dangerous to do so alone. This single fact, the backward baby, may be the reason why humans are the only primate on Earth that routinely requires help during birth. Wenda Trevathan, Regents Professor of Anthropology at New Mexico State University, spent decades studying birth across primate species. She proposed something called the Obligate Midwifery Hypothesis. The argument is simple. Because human babies are born facing away from the mother, and because the fit between the baby's skull and the mother's pelvis is so dangerously tight, human women evolved to seek assistance during birth. Not as a cultural preference, as a biological necessity. Actively assisted birth is extremely rare in other primates. In humans, it is universal. Across every documented culture on Earth, women give birth with someone else present. There is no recorded society, none, where women routinely deliver alone. Trevathan and Rosenberg suggested that this pattern may go back as far as 5 million years, to the earliest hominins who walked upright and began to experience the pelvic changes that made birth more difficult. The moment the pelvis narrowed for bipedalism, the mother needed help. And from that moment on, birth became a social event. The word midwife literally means with woman. It is one of the oldest human professions, older than farming, older than building, older than anything that modern humans would recognize as a job. Long before anyone understood anatomy, long before anyone had a word for complications, there was someone whose role was to be present when a baby was coming, to hold the mother, to catch the child, to do the one thing the mother's own anatomy made impossible for her to do alone. Now here is something that would surprise most people alive today. The position you think of as normal for giving birth, lying on your back with your legs in the air, is roughly 300 years old. For the entire history of our species before that, women gave birth upright, squatting, kneeling, standing, holding onto a rope or a tree or another person. In 1882, a researcher named George Engelman documented birth positions across dozens of non-Western cultures and found the same thing everywhere. Women avoided lying on their backs. They moved freely. They changed position as the labor progressed. They squatted on bricks, knelt on soft ground, held onto poles or ropes hanging from the ceiling. Cross-cultural data confirms that only about 18% of traditional societies used a lying down position for birth. The other 82% were upright. The change happened in 17th century France. A male obstetrician named Francois Morisot popularized the semi-recumbent position, the woman on her back, because it gave him better visibility and easier access to use instruments like forceps. The position was not designed for the mother's benefit. It was designed for the doctor's convenience, and it stuck. By the 19th century, lying on your back became the standard in Western hospitals, not because it was safer, not because it was less painful. Research has shown the opposite. Upright positions use gravity to assist the baby's descent. They widen the pelvic outlet. A Lancet trial in 1989 found that squatting reduced the need for forceps deliveries and shortened the second stage of labor compared to lying down. For 300,000 years, women gave birth the way their bodies were designed to give birth. Upright, mobile, supported by other women. We changed that in a single century. Not for the mother, for the doctor standing in front of her. But even with the right position, even with experienced hands helping, even with everything done correctly, ancient birth was a gamble. The estimated maternal mortality rate without any medical or surgical intervention is approximately 1,500 deaths per 100,000 births. That means roughly 1 in 67 births killed the mother. In pre-industrial England, where records survive, maternal mortality averaged about 10 to 25 deaths per 1,000 births, and the weeks immediately following delivery were the most dangerous period in a woman's life. The killers were the same ones that still kill women today in regions without access to medical care. Hemorrhage, uncontrollable bleeding after the placenta detaches. Obstructed labor, when the baby simply cannot fit through the canal. Infection, when bacteria entered the body through tears and wounds that had no way of being sterilized. Ancient women had no sutures, no blood transfusions, no antibiotics. What they had was each other. They had pressure applied with hands and plant fibers to control bleeding. They had herbal preparations, some of which, like ergot-producing fungi, contain compounds that modern medicine still uses to manage postpartum hemorrhage. They had warmth, movement, gravity, and the accumulated knowledge of every woman in the group who had given birth before them. It was not enough to save everyone, but it was enough to save most, and the knowledge passed from grandmother to mother to daughter across thousands of generations without a single written word. For 300,000 years, birth was not a medical event. It was a social one. A woman did not go to a building to deliver her baby. She stayed where she was. The people who knew her gathered around her. Someone held her from behind. Someone knelt in front of her to catch the child. Someone was already preparing warm water and soft hides for the moment after. The baby came out facing away from her, and that is why someone else was always there. Not because it was tradition. Because the architecture of her own body made it impossible to do this alone. The backward baby, the twisted canal, the tight fit. Every single feature that makes human birth dangerous is also the feature that made humans social. You needed someone else to deliver your child, and that need, repeated across every birth for hundreds of thousands of years, is one of the oldest reasons human beings learned to depend on each other at all. Today, birth is safer than it has ever been, and that is extraordinary. But something was lost when we moved it from the firelight to the fluorescent light. For 300,000 years, the first thing a baby saw was a circle of people who already knew its mother's name. That is the part no monitor can replace. But getting the baby out was only the beginning. What happened next? Keeping that baby alive in a world with no formula, no clean water, and no medicine was even harder. And the reason starts with a deal your species made 2 million years ago.